Recording in progress.
Hola, buenos días, buenas tardes a todos. Bienvenidos a la conferencia de prensa.
Good morning, good afternoon to all of you. Welcome to PAHO's press briefing. Today, Wednesday, April 6th, 2022. My name is Luciana Viegas, advisor on public affairs with PAHO. We have interpretation into English, Portuguese, French, and Spanish, and you can also ask questions using the Q&A button. Please remember to state your name and media outlet when sending your question. And I would like to thank the journalists who already sent that question ahead of time today. The Pan American Health Organization's director, Carissa Etienne, will be updating us on the situation of COVID-19 in the Americas, and she will be addressing also Health World Day that will be celebrated tomorrow on April 7th. We have with us Jarvis Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Health Emergencies Director, and Dr. Sylvain Aldiguieri, Incident Manager for COVID-19 with PAHO. So we start with the opening remarks by our Director, Dr. Carissa Etienne.
Thank you.
Thank you. A warm good morning to each of you. Thank you for joining us at today's press briefing. Over the past few weeks, COVID cases and deaths have dropped across most countries and territories in the Americas. But our region continues to record more than 620,000 new cases every week. And in some places, infections are rising again. In North America, cases in Canada increased by 1/3 compared to the previous week, and hospitalizations rose by 10%. Across the Caribbean, 15 countries and territories also saw a surge in new infections. Reports of deaths have also risen in some countries throughout the region. However, adjustments in data may well account for part of these increases because some countries are reclassifying past deaths as due to COVID. These new waves that we are seeing come just a few weeks after the dramatic surges that Europe and East Asia experienced as the Omicron sublineage BA2 spread through their populations. We know that what has happened elsewhere in the world foreshadows what our region may face. Time and time again, we've seen how the infection dynamics in Europe are mirrored here just a few weeks later. In fact, Omicron BA2 has already been detected in 8.7% of the sequences reported from South America in global databases. In the Caribbean and across North America, Omicron is becoming the predominant variant circulating in our communities. Along with increasing tourism and travel and the relaxation of public health measures, Omicron circulation is driving the new COVID surges that we are seeing. We cannot ignore the risk of further COVID-19 surges in other parts of the region. We must face it together with caution, but also with confidence, because we know what it takes to protect our people. First, it is important to continue filling our vaccination gaps to protect the most vulnerable. The elderly and immunocompromised remain the people most likely to be hospitalized following COVID infection. Omicron has made it crystal clear that vaccines are our best bet to protect them and everyone else from severe disease and save lives. More than 685 million people in our region have completed their COVID vaccination schedules, and 50 countries and territories have already begun to deliver additional doses and booster shots to their eligible populations. The addition of this booster dose to the primary series is key for people at higher risk for severe COVID, who may need an additional dose to remain as protected as everyone else. But the gaps that still exist will keep our region at risk during future waves. Despite all of our efforts and efforts of member states, 240 million people in the Americas have yet to get a single shot of COVID vaccine. Together, we have secured the necessary vaccine supplies. Now, we need to redouble our efforts to ensure that our vulnerable populations receive the doses that they need to remain protected against COVID-19. And we need to do that as soon as possible. Countries must also continue to monitor this virus to stay prepared for what is coming next. Throughout the pandemic, testing has been a critical tool to track COVID spread. But today, some countries have changed their testing strategies, making it more difficult to get the full picture of BA2 in our region. Countries must keep testing capacity in place so we do not go into this next wave blind. This means making tests easily accessible for everyone everywhere to prevent new outbreaks and to prepare our health systems if cases surge. And the third and final priority is for countries to continue to make evidence-based decisions. Over the last few weeks, many countries and territories in the Americas have scaled back public health measures, and some have done so prematurely. As travel restrictions have loosened, case counts have risen in places that rely on tourism, especially in parts of North America and the Caribbean, where vaccination coverage is low. It is important to continue to rely on data as our eyes and ears into this pandemic. And just as we did before, we must adjust our strategies when cases rise to save lives. Tomorrow, as we celebrate World Health Day and this year's theme of Our Planet, Our Health, we wish to make an urgent call to work together towards a healthier, more sustainable future so that we can withstand this next phase of the pandemic and other health crises. It is undeniable that climate change has presented significant threats to our region's health. Higher temperatures and air pollution have led to rises in cardiovascular and respiratory diseases in the Americas. Extreme weather events, droughts, and wildfires have caused crop failures and displaced people from their homes, driving malnutrition and forced migration. Our health systems are also at risk, as too many of our hospitals were built in places vulnerable to floods, hurricanes, landslides, and other extreme events. We are working to address this throughout the region, but we all need to move faster. Health system resilience is not just a necessity to overcome COVID, it is an investment for our future. As we prepare for the next emergency, we are counting on countries across the Americas to continue making health their collective priority. Over.
Thank you very much, Director. Pasamos ahora a las preguntas que nos han enviado con
We now
antelación.
move on to the questions that we have received ahead of time and that we also have on the chat. The very first one by Javier Hernandez Garcia from Telesur from Mexico, and a similar question by Evelyn Mesa from the Republic Peru. I am going to read the question in English for the director.
Several countries have relaxed health protection measures against COVID-19, as you said, including some municipalities in Mexico. Is this prudent, considering the increase in infections in countries that have opted for this strategy? Dr. Tien.
So let me thank you for this question, Javier. As you know, cases of COVID-19 are falling overall, but we still have more than 620,000 new cases a week in our region. And each of these infections has the potential to cause severe disease or death, especially among those who have not been fully vaccinated. So let me say that the pandemic is not over. And so we urge people to remain cautious. Whether you're traveling or staying home, the same advice applies. Most importantly, get vaccinated and always wear a well-fitting mask when you are around other people. Stay at least 1 meter away from others. And even where restrictions are relaxed, please exercise caution by avoiding what we call the 3 C's. Stay away from closed spaces with poor ventilation. Avoid crowded places with many people nearby, and dodge close contact settings like face-to-face, close-range conversations. The risk of infection and outbreaks increase when these 3 C's overlap. So protect yourself by not going to crowded parties and evaluating your risk in shopping malls or closed spaces. Wear a mask and when possible, open windows to ensure air circulation. Wash your hands frequently and don't touch your mouth, your eyes, or nose with unclean hands. Be on your guard and do not drop your guard. It is not yet time.
Thank you very much, Dr. Tien, for those messages. Tenemos una segunda pregunta de Javier Hernández de
We have a
Telesur.
second question by Javier Hernandez from Telesur. Is there any risk for persons who combine different vaccines against COVID-19 to complete their vaccination schedule and boosters? Dr. Barbosa. Thank you for the question. First, it is important also to underscore at all times that all the vaccines that are acquired through the revolving fund of the Pan American Health Organization are authorized for emergency use by WHO. Also, all of the vaccines that are acquired through COVAX have the same WHO certification. These are vaccines that were proven to be safe for use. The initial recommendation, it is always for the individual to take the whole vaccination schedule with 2 or 3 doses for some cases of the same vaccine. But we already have evidence that is sufficient to show that it is possible to have the third dose, for example, for the elderly or individuals who have immunocompromised systems with a different vaccine, and that does not have any risk on the individual. We have seen, for example, according to the study, that for 2 initial AstraZeneca vaccines and a follow-up or a booster with RNA messenger shows that there is no problem. So we always ask you to follow the recommendations in your country, in the ministry, because oftentimes the recommendation for the third, for the booster, are taking into account what is clearly stated and also the availability that the country has. So if the country is advising to have the third dose with the same vaccines, that is a possibility, but other countries are recommending that vaccine with that third dose with a different vaccine. There is no risk, and the recommendation of the National Health Authority has to be followed at all times. Thank you. Thank you, Dr. Barbosa. Now we move on to a question by Erika Cabal from the International Radio. Erika is asking us to the percentage of improvement worldwide and also the percentage of spread of Omicron variant. Dr. Aldiguieri, thank you for those 2 questions. And we can have a difference in the interpretation of the word recovery and improvement. So I am going to touch upon 2 different aspects. If the word recovery focuses on the world situation, the epidemiological situation worldwide, we can say that worldwide between weeks 12 and 13, week 13 from the epidemiological point of view is the one that concluded on April 2nd. The 6 WHO regions reported a drop in the number of cases, and the most important significant drops were seen in Europe, in Western Asia, and also in Asia in general. So as we have seen before, there is a mosaic here of the dynamics of the pandemic, differences among the regions, countries, sub-regions, and also subnationally. So if the focus of the question from the point of view of recovery is for the patient, that is to say the clinical recovery, we can say at this point in time that the percentage of persons who have recovered completely from COVID-19 is difficult to quantify, since we see reports that show high number of surviving patients that have persistent or long-term symptoms or even some sort of damage in one or more systems or organs. We also see individuals who have survived the initial infection, but that have reinfected in general with the second variant of SARS-CoV-2. As to the knowledge we accumulated over the last 2 years in unvaccinated patients, we know that about a third of infected cases stay asymptomatic, and those that are symptomatic have mostly a disease that is not severe, but about 20% of those patients that are unvaccinated have critical or severe disease. That is, that the vaccine protects the vaccinated population largely. Those vaccinated individuals who have severe disease tend to be elderly or have important comorbidities such as immunosuppressed individuals, individuals with immunosuppression of all ages, or individuals with advanced chronic kidney disease. Now, as to the spread of the Omicron variant, based on the information obtained in global databases such as GSAID, about 99% of the sequences reported in that database worldwide match Omicron and the various sublineages, with very few sequences of a different variant, including the so famous Delta variant in some geographical areas, in particular in the southeast of Asia. In the region of the Americas, the situation is similar, with an absolute prevalence of Omicron in the sequences reported over the last 4 weeks. However, contrary to other regions where the sublineage BA.2 of Omicron is the prevailing one, in South America, less than 9% of the sequences reported match this BA.2 sublineage. And the BA.1 and BA.1.1 continue to be the dominant ones in 99% of the reports. In the Americas, the highest spread of BA.2 has been seen in North America and the Caribbean, but the increase has been quite gradual, and we have not had a significant increase in transmission or changes in the clinical presentation of the disease. So I hope I have addressed both questions with the two variations identified at the outset. Thank you. Thank you very much, Dr. Aldigueri. Now we move on to a question by Matias Lowy from Argentina for Medscape in Spanish. Matias is asking, how concerned are you about the drop in test supply for COVID-19? Is it normal, or is it something that could pose a problem for us to be able to identify future outbreaks? Thank you very much, Luciana. This is Dr. Ugarte, and thank you, Matias, for your question. Yes, and given the drop in cases and also with the perception that the pandemic is decreasing and that there is a greater feeling of certainty and security, the number of tests carried out is lower, and also the number of confirmed cases is also lower. In this context, our concern is that the countries need to implement the measures based on the rational use of the supplies throughout the health systems. For example, diagnostic testing and also sampling and others that are included in the recommendations issued by WHO on January 10th, 2022. So our concern is lower as the recommendations are implemented, and the countries of the Americas are also preparing and adapting their surveillance systems to have timely information to be able to follow the trends and also to anticipate an unusual surge. In spite of that, PAHO continues to work with the countries and the territories to maintain testing strategies to be able to detect timely those cases. And we are also strengthening and integrating COVID-19 surveillance with influenza. And in that fashion, we can be sure that we will have the necessary information for follow-up and also to make the proper decisions to relax or implement new measures as outbreaks may occur. As our director has mentioned, we need to adapt our answer, but at the same time, our response, but we need to be very cautious and vigilant of new outbreaks so that we can respond fast, and we hope that we can finally control the pandemic during the course of this year. Thank you very much. Thank you, Dr. Ugarte. The next question is by Henry Cardenas from La Prensa in Panama. What is PAHO's assessment of the epidemiological situation of Panama? Can you say that the country has controlled the pandemic? And with the new surge of cases in some European countries, could this also have an impact on countries such as Panama? Dr. Ugarte, again, we stay with you. Thank you, Luciana, Henry. We think that Panama has properly addressed the situation considering all of the factors and has acted properly. The level of transmission of the last couple of weeks has diminished, and it has stabilized, has a plateau at 200, 300 cases a week. And the positivity rate has also diminished. It is about 5%, and lethality is about 3 or 5%, and there is no reported death, and that is very important. So after implementing some of the relaxation of the measures, we have not seen a new surge in the number of cases. But in connection with the previous question, we know that surveillance is being conducted, and also that the measures are being implemented to quickly detect cases that could come up and also adapt these measures. We need to remember that the adaptation of the measures is flexible. We cannot expect that now that we have relaxed the use of masks, this is the situation that will prevail in the future. Measures need to be implemented as new cases come up, as new outbreaks are reported, so that we do not reach the situation we had before. For example, the number of cases in ICU in Panama is at its lowest levels. So it is clear that there is proper work, and there is also follow-up, as we do with our PAHO office in Panama and all of the health team in Panama and all of the other sectors. This is being productive and positive. Thank you. Thank you, Dr. Ugarte. A question from Mexico. Melina Ochoa from UNO TV has two questions. The first one is, this Tuesday, the Secretariat in Mexico informed that the pandemic has been dropping over the last 10 weeks. Does PAHO share this? And Mexico has not reached a plateau, correct? Dr. Aldigueri.
Thank you for your questions regarding the situation in Mexico. For the last 10 weeks, Mexico has seen a continuous reduction of cases due to COVID-19. From March 21, 22 federal entities in Mexico are in the green color, according to the criteria established by the Health Secretariat with their traffic light coding. Comparing between epidemiological weeks 12 and 13, the decrease was less 4.1% compared to the previous week. So it is a decrease of 19%, fewer. Hospital occupation lowered 7% in occupation, and in ICU beds, the occupation rate is 2%, and there is a continuous decrease in the number of active cases. Yesterday, reports came down to 7,300 active cases, which is a historically low number since the beginning of the count of cases due to COVID-19. So, however, we recommend not to relax preventive non-pharmacological measures given the instability of the international situation, we cannot rule out another outbreak, and there's always the possibility of emergence of new variants of concern. I would like to emphasize that we need to pay special attention during holidays and where crowds accumulate. So, given an increase of cases in some parts of the world, we recommend to continue to have access to vaccines against COVID-19 for the population who have not completed their initial schedule or booster shot. And so to continue to be uh, alert. I hope I have answered your questions. Thank you, Dr. Aldigueri. Second question of Melina is related to Mexican health authorities have invited the population to be part of a clinical trial for the vaccine called Patria. What's the stage of this vaccine and when will it be considered and be analyzed by WHO for a possible authorization? Dr. Barbosa. Well, this is good news, as we have said before, of the efforts made by different groups of scientists in our region to develop vaccines against COVID. We have developments in Cuba, Brazil, now in Mexico, and this is very important. It is a vaccine that is being tested in a phase 2 clinical trial, and the proposal is to have it as an alternative for boosters, for those requiring the boosters, such as immunocompromised the persons as well as the elderly. So again, let me underline that vaccines that are under development, they are doing all the tests that are necessary to have both safety and efficacy levels certified. So after the phase 2 trials, which are done to confirm safety of the vaccine, and then the phase number 3 will start. It will last longer. This is the phase that will confirm effectiveness, efficaciousness of the vaccine against COVID. So first we have to wait for the process to take its full course. So because for a vaccine to be assessed and receive from the WHO, the EUL, it must have gone through the phases 1, 2, and 3 of clinical trials, and it has to be produced by a manufacturer that has received a certificate of good practices in manufacturing. So we are very happy for Mexico, and we hope they will have good results during the phase 2 and phase 3 trials, but only after all of these trials have been completed can the vaccine be submitted for a potential EUL by WHO. WHO does not give authorization for use for vaccines that are still in development. So for all vaccines, the procedure has to be the same. They need to first complete all the clinical trial phases, make sure that the manufacturing is also certified, and then it can go for the WHO evaluation. Thank you. Thank you, Dr. Barbosa. Now we have a question from Peru. Yerson Collave from El Comercio says in Spain, they are not using masks in closed spaces. So what does PAHO think about this? When could we start to see a decrease of mask use in enclosed areas? Thank you, Luciana. To this point, one of the most important measures and most efficient measures to control infections and in response to COVID is the appropriate use of masks. And let me emphasize appropriate use. It's not only general use. we need to have certain considerations with respect to how we will wear our mask, when to wear it, and eventually when to take it off. And so many times people are wearing their masks during transportation, going to work, commuting, attending meetings, but in closed spaces, especially when they are eating, of course, they have to take off their masks. And in those enclosed spaces, when there is little ventilation, then there is an increase of the possibility of viral particles to increase and accumulate, which may lead to an increase in infections, which is high enough, even to the point of generating outbreaks. So our recommendation continues to be the same, taking into account the circumstances that we have mentioned before, regarding levels of transmission, bed occupation, positivity, and other aspects related to infections. Any relaxation measure in use of masks has to have as a counterpart a very agile system of quick detection and implementation of focal measures directed to those spaces where there is an increase in transmission. Constant flow of air avoids accumulation of viral particles and therefore decreases, although not necessarily eliminates the possibility for transmission. So it is a complementarity of actions. So when we find variants that are highly infectiousness or high transmissibility, the use of masks has been one of our first containment barriers. And we would say that it is necessary to continue to use them as long as we continue to have levels of transmission that are of concern. Thank you very much. Thank you, Dr. Ugarte. Now we have questions from the Caribbean.
Royston Jones, Associate Editor at Eyewitness News in the Bahamas. Royston has a couple of questions. The first two about variants. Question one, has the Omicron variant been confirmed in the Bahamas? And what is the dominant strain at less reporting? The second part of the question also, has any testing confirmed the presence of the subvariant BA.2 in the Bahamas? Dr. Altighieri.
Yes, thank you for this question from the Bahamas. Omicron is the predominant variant of SARS-CoV-2 that has been detected in the Americas, including in the Caribbean. Regarding the situation in the Bahamas, I would say that thanks to a very close collaboration between the National Public Health Laboratory and the PAHO office and in Nassau and the PAHO Regional Genomic Surveillance Network, it was possible to detect and to characterize the circulation of the variant of concern Omicron in samples that were taken by the reference laboratory in Nassau. And these samples were processed and sequenced at the Gorgas Institute in Panama during the month of February. So far, only the sublineage Omicron BA.1 has been detected in the Bahamas. Nevertheless, as part of a sustained effort from the National Public Health Laboratory, 100 additional samples were sent recently to the reference laboratory in Panama, the Gorgas Institute, to maintain the surveillance and to early detect the introduction of BA.2. When available, the results will be shared timely and the sequences will be uploaded in the global database. It's a usual process. So I hope I have answered the concerns from Eyewitness News Bahamas. Thank you.
Thank you, Dr. Altighieri. The next question from Royston is, what is PAHO's recommendation for second booster shots in the region, especially given the reduced vaccine effectiveness to new variants? Dr. Barbosa, please.
Thank you for this question. But first, let me clarify that the vaccines that have been used are effective against the new variants. They are protecting people against severe forms of disease. All the data that we have are showing that the current pandemic the pandemic of severe cases, hospitalized cases, are mostly cases among people that are unvaccinated or people that don't have the full vaccination scheme. So the vaccines can protect and are protecting people against severe forms of disease. About the booster, WHO and PAHO have already made a recommendation for some vaccines like Sinovac vaccine that in some countries is known as CoronaVac. There is a recommendation that the people at 60 and plus, or people that have an immunocompromised system, need to take a 30 doses. And there was a more recent recommendation that in this case, for these vaccines, if a person is immunocompromised, at least 4 months after the 30 dose, probably this person will require a fourth dose. But so far, this needs to be utilized very carefully, because in many countries, we still have to offer vaccines and to have people taking the full vaccination scheme. It's important to highlight that we don't have any evidence that says that the people who had get the COVID only needs 1 dose of vaccine. This is not true. When we see the gap that we have in Latin America and the Caribbean, people that have received the second dose, but they are still pending the third doses, we see that we have a lot of work to do to get the people fully vaccinated. The only way that you are protected is that you are fully vaccinated. So follow the recommendations of the Ministry of Health about the groups that can have access now for the booster and the third doses, because this is the only way to staying protected against these variants that are circulating, or even future variants of concern that can emerge. Thank you.
Thank you very much, Dr. Barbosa. Pasamos a una pregunta desde Paraguay. Mirta Osuna, de la prensa, pregunta qué conclusiones se puede sacar de la pandemia del COVID-19.
What conclusions can we draw from the COVID pandemic, and how can we think in terms of future emergencies, health emergency? Well, this is one of the most important questions in terms of how the world will face new emergencies or similar emergencies. Even though this type of pandemic has occurred after 100 years, there are some conclusions that are evident. It is necessary to strengthen the health systems in the countries, especially so that they can respond in time, detect in time, and control outbreaks and epidemics and other health emergencies from the local level and going up to the most complex levels in the health system. This means that a specific investment needs to be made that the health sector has mentioned during many years. And let's hope that in the future, we can invest more in health services, in facilities, so that we can detect diseases more quickly. The impact of the pandemic is social, economic, political, and the impact is also related to other diseases and processes that have increased general mortality in levels that that will have long-term repercussions. In this sense, collaboration and cooperation among detection, alert, and response systems among countries and among continents is one of the main elements that are being discussed globally. So it is not only financing, but implementation of the measures, including the use of the international health regulations and other instruments. If something has been shown by this pandemic is that we are in this together, all of us, and we need the participation of everyone in order to be able to confront and ultimately defeat the pandemic. Many of the decisions and repercussions of the pandemic go beyond the health sector. So it's not only the health sector, but all sectors. So in all recommendations that we have given, we hope will become concrete results that will lead to a safer world. So discussions and negotiations among countries continue. So let's see what the results of the World Health Assembly will be this year. Some decisions will be made, some resolutions will be submitted that countries will adopt related to what we have learned from the pandemic and what we still need to learn from this pandemic. Thank you very much. Thank you, Dr. Ugarte. We have a few questions regarding the variant XA. I have a question from the variant XE, and we have a question from Mariana Suquet from Efecto Cocuyo. Could you please talk a little more about the XE variant? Has it been detected in the region, and what countries is it circulating in? Dr. Aldeguerri, please. Thank you for your questions. We understand there's a great deal of concern regarding this issue. What is important to recall is that the SARS-CoV-2 virus continues its evolution. This is the evolution of the virus. And so with significant transmission at world level and also at regional level, of course, it is expected that there will be variants during week 13, which is the week ending on April 2nd. Worldwide, more than 9.5 million cases, new cases were reported, and the Americas, over 500,000 new cases were reported. So with such an intense degree of transmission, new variants, including recombinant processes, are going to emerge. It is an expected situation. So WHO and PAHO are tracking different variants, keeping track of them, including Omicron, which, as I said, is the predominant one at global and regional level, including the recombinant forms of it, including the so-called XD variant, which is a combination between variant Delta and variant Omicron, and the so-called XE recombinant, which is a recombinant between sublineages of Omicron BA1 and BA2. So again, let me repeat that it is an expected process, part of the evolution. When there is co-infection of the same cell with two viruses with characteristics that are a little different between them. So the XE variant has been traced and tracked down under the concept of the Omicron variant. It is a recombinant form which was detected first in the United Kingdom at the end of February of this year. And to this date, I think that in Europe, some hundreds of sequences were reported and confirmed. So we do not have reported confirmed evidence of its appearance in the Americas. And I'm talking about the XE recombinant form, and our genomic surveillance system is on alert and will make reports whenever there is suspicion of circulation of that recombinant form. And that's all I can give you as far as this recombinant is concerned. I hope I have clarified this topic for you. all. Thank you. Thank you very much, Dr. Aldigueri. Now, we have a question from the Caribbean, Annalisa Paul.
Can you say what PAHO WHO social distancing regulations are currently, as schools in Trinidad and Tobago get set to open on April 19th for all students. And some schools cannot accommodate everyone due to space constraints. Pardon. What is your advice? Dr. Ugarte, please.
Thank you, Luciana, Annalisa. The measures, as was mentioned several times during this press briefing, have to be adapted according to what is the transmission level, what is the capacity of health services, the positivity rate of tests, and other measures. In that regards, there are many things that need to be implemented, particularly when we are looking for the children to go back to school. We know that some of the areas need to resume activities, and particularly the children going back to school is a big need. And we need to put a balance between what is the situation of the pandemic in general, in any community, and but also how we can resume what we have been losing a lot in terms of children education. In that regards, there were several recommendations, not only on social or physical distancing, but also on the use of masks and the adaptation of the school facilities, including ventilation, for example, having different schedules, including, for example, that most of the school staff must be protected, but also, of course, vaccinated. And also to implement several actions once the children go back to school. You mentioned this physical space of the rooms, for example. We said that we can change the schedule, so it will be an adaptation of the classes and the topics and for example the areas when they have breaks or so to allow all the students to go back to school if feasible. And the other aspect is to implement at the school level all the other measures that will reduce transmission, but at the same time to detect on time the presence of the virus. The worst thing that we would like to see is an outbreak in a school setting because we are not following the recommendations, even in very low transmission levels. And that will, turn into a closing school, back to closed schools. We don't want that. So in that regard, there are, each recommendation is that a recommendation that must be implemented by the national authorities. And we recognize that Trinidad and Tobago is taking this seriously and is adapting these measures, and our country office and several other recommendations are being taken into account in taking these decisions, but also in monitoring its impact. Over. Thank you.
Thank you very much, Dr. Ugarte. Pasamos a una pregunta desde Venezuela, Juan Carlos Ramos, de Crónica 1.
Now, a question from Crónica 1, from Juan Carlos Ramos. Venezuela has debt with the revolving fund. What do you know about this? Has there been some progress? And when will be the next shipment of from COVAX to Venezuela? Yes. The revolving fund has guaranteed access of countries from Latin America and the Caribbean for over 40 years to vaccines of affordable prices. Yes, there is a 12 million debt by Venezuela at this point, and some efforts are being made so that funds can be obtained for Venezuela to pay this debt. Venezuela is, COVAX is making purchases of vaccines for Venezuela. So the debt is not a barrier for vaccines to arrive in Venezuela because as I said, they're going through the COVAX mechanism. 6,756,000 doses of COVID vaccines have arrived, and they will be receiving 1.2 more million doses at the end of April or beginning of May. So work is underway so that Venezuela can pay their debt with the revolving fund. But vaccines for COVID will continue to arrive in Venezuela so that the country can continue onward with their vaccination program. Thank you. Thank you, Dr. Barbosa. We have come to the end of our session. We have time for one last question for the director.
The World Health Day is tomorrow, 7th April, and you said PAHO is counting on countries to continue making health their collective priority. But what are some of the things that people can do themselves for our planet and our health? Dr. Tien.
So thank you for that question. Yes, tomorrow we will observe World Health Day. And we do have a World Health Day campaign with actions that governments, corporations, mayors, health workers, and yes, individuals can take to help protect our planet and our health. While the COVID-19 pandemic has had a devastating effect on society, we must also deal with the health effects of pollution, the threat from the climate crisis, the rising incidence of mosquito-borne diseases, and the systems that produce unhealthy foods and drive a wave of obesity while generating greenhouse emissions. On World Health Day and throughout the year, we ask people to take what action that they can to reduce their energy use, to use public transportation, and to avoid highly processed foods and beverages. We may have survived a pandemic, but we still see 7 million preventable deaths and many lost years of good health due to air pollution worldwide. So everything that we can do to reduce pollution is going to be important. For instance, walk or pedal to work at least one day a week. Choose public transportation where available. If you have a choice, change to a renewable energy provider and lower your energy use. Buy fresh groceries from local producers and avoid highly processed foods and beverages, particularly sugar-sweetened beverages. Just remember that tobacco is a killer and a polluter. So stop consuming tobacco, buy less plastic, use recyclable grocery bags. These are just a few of the things that individuals can do to reduce the ill effects on the planet and at the same time on our health. Thank you so much for joining us at today's press briefing.
Thank you very much, Dr. Tien, for those final words and ideas of what we can do for our planet and our health. Y a los periodistas, llegamos ahora al final de nuestra sesión de hoy.
This is the end of our briefing today. We will have our next briefing in 2 weeks. And please be on the alert from our emails so you can send follow-up questions to our team. And you will find more information about the situation on COVID-19 and the status of COVID vaccine shipments on our website. Thank you very much for signing on, and we will see you in a couple of weeks. Thank you and have a good week. Thank you very much.